Because we cannot talk about the myths if we do not understand what stem cells are. So, what is stem cell therapy? Why are there so many issues about it? And of course, improve the body. Repairing your body. But if they sleep, then they will not repair. That's why you have osteoporosis. And now it's available. Thousands of patients around the world have already benefited from this technology. The ones considered incurable are now, and the nice thing is it restores the quality of life to patients they thought they never had and had totally lost forever. So, they always say that stem cell is experimental. So, 443 clinical trials on stem cell, 2,000 completed adult stem cell trials, and 5,100 reviewed on stem cell. Stem cell is 50 years old. Technology is 50 years old. So this is what we ask always. What is permitted? When we talk about sex like animal based, di ba late yung baba black sheep? Because I'm man cow. So maybe I can, but technically you cannot do that. Your body will reject. Plant-derived, apple stem cells, soya stem cells, date stem cells, you have to pass through FDA. Allogenic, meaning from other people, it has to go through strict HLA matching and DNA tissue typing. And what is allowed is only whether bone marrow, cord blood, adipose, and many other tissues from your own body. From your own body. That is what is allowed. So the rest, no. Okay? So the basic stem cell is the fertilized egg. Now we ask a very nice question always. How old are you? Ikaw, ilang taon ka na ngayon?
57, sir.
Are you sure?
Yes, sir.
57 when you went out of the vulva of your mother. Okay, what about you were 9 months inside your mother? You did not count your life? NSO ang binabasihan. When you talk about life or your age, it includes all the generations before you because life is a continuum. So if I ask you, how old are you? You'd say, I'm 1,000,000 years old, more than 1,000,000 years old. Why? Because if there is any breach, then you are not here. So you see how old you are? You're really old. Okay. Now, on the right lower side, you will see siopaw. Yung parang siopaw, walang paa. That is a sleeping stem cell. Just below it, the one with pseudopods, yung mga paa na lumalabas, that is an active stem cell. Now, we would like stem cells to be always in their active stage so they can do repair and replacement. This is a very active stem cell. It is always producing growth factors, chemokines, cytokines, and many other things. These are adult stem cells. You see that infant is already considered adult, yung stem cell niya. And when we talk about embryo, we're talking about 5 to 7 day old fertilized eggs. Okay. This is a very old technology, bone marrow aspiration. This is painful without anesthesia. You have to anesthetize down to the periosteum. The problem is there might be atrophy of the harvested site. But the bigger problem is the maximum harvest is only 60,000 stem cells, maximum. The therapeutic dose is 1,000,000. So you have to culture your stem cells so it will reach 1,000,000 before you can give it to your patients. So on the left side is the embryonic, and you will notice below that there is a potential for teratocarcinoma and teratoma. The same with induced pluripotent, and this is a problem. The best now would be adipose-based. A lot of bone marrow practitioners have now shifted to adipose because of these functions. Later on, you'll find out. When we do animal, we have a problem because animals have chromosomes and genes and DNA. And this will encode in our body. The ancestry will go out. So if you took apple, you become an apple. Or if you use sheep, then eventually you become a sheep. If it will grow in your body, but it doesn't grow. These cells will not grow in your body. So they have three properties. They are undifferentiated, meaning to say they are blank cells. They have the capacity for self-renewal for billions of years or millions of years. And more important is the plasticity and potency. It can become the cell that needs to be replaced in your body. Of course, there is homing, the innate capacity to go to the target area for repair, and engraftment is attachment to damaged tissues to replace it. So what happens? The stem cells, if you notice the curve of deterioration or become dormant, I like the upper slide because most of your pain, neck pain, shoulder pain, back pain. But this one, you will notice the increase in weight is the one giving more pains in the knees and your joints. I work pain day in and out. It's nice to see the faces of patients once they were in or when they have been given platelet-rich plasma injections. The guy there is so big he cannot even see his third leg. Despite the fact that there are two beautiful women trying to let him stand up, it can't stand up. Understand? But America has a population which is 2/3 obese. That is why in the next few years, they will be exporting stem cells. Because the adipose cells is in the abdomen, between the umbilicus and the genitalia. They will be exporting stem cells and growth factors to us in the Philippines. Why? Because we don't have too much obese people here. Nakita ko nga yung sign, Taba. Yun, di ba? Taba Congress, wala pa man ako nakitang taba. You go to the States, you go to the mall, and you will see what taba really is. Okay? This is the area that we want to harvest actually between umbilicus and genitalia. Yung tinatawag nating puson. Now why? Dr. How do you pronounce his name? Longacre of Stanford University. This is what he says. They will be exporting liquid gold. They have so much in America. So that's good industry. Exporting liquid gold, which is stem cell or stem cell products. Now they found out that the lipoaspirate and liposuction is very high in stem cells. Zook and Associates in the year 2000, they were the ones who discovered that. And so the threshold is 1 million. The problem with bone marrow, it's only 1,000 stem cells that you can get from 1 gram. The maximum harvest is 60,000 stem cells, but on fat, 1 gram is equivalent to 5 million stem cells. If the dose is 1 million, 1 gram alone of fat is already the therapeutic dose. But normally, we harvest from 100 to 200 grams of fat. It will repair. So fat stem cell extraction Dr. Purita, who has been here going around lately,